Hello, I'm Kaylin. I'll be doing a newborn assessment today. So first I'll walk into the room and do hand hygiene, put on gloves, introduce myself to mom and baby, and tell her that I'll be doing a newborn assessment. Then I'm going to make sure that her armband matches up his armband. Then I'm going to go over to the baby and I'm going to make sure that there's a bulb syringe in the bassinet. So first I'm going to take off his hat. Then I'm going to look at the suture lines. So sagittal suture, and everything looks good. Then I'm going to do the fontanelles. So they're soft, non-bulging, not indented. Then I'm going to look at the shape of the head, make sure it's a good round shape. Then I'm going to look at the eyes, make sure that they're lined up with the ears. And then I'm going to take my pen light and see if the red reflex is present. And it is. And look at Perla. So his eyes are Perla, 3mm pupil size. Then I'm going to look in the nares, make sure they're patent. And then I'm going to look in the mouth, make sure his oral mucous membranes are pink and moist. And then I'm going to occlude one side at a time and make sure that he can breathe. Then I'm going to stick my gloved finger in the root of his mouth and assess the palate, make sure it's there, make sure there's no cleft lip or anything. Then I'm going to see if he has any teeth. And then I'm going to assess the rooting reflex. So I'm going to tap his cheek and he's going to turn his head. And then tap this cheek, he's going to turn his head. And then I'm going to put his hat back on. And I'm going to make sure that he can move his neck back and forth. Make sure there's no webbing in his neck because that is abnormal. Then I'm going to check his skin turgor. So it is resilient. So then I'm going to unswaddle him. Then I'm going to make sure that he's warm, clean, dry, and intact, his skin. Make sure he has a pink trunk and blue extremities, which is acrocyanosis. Then I'm going to look at his nipples, make sure they're intact, make sure they're not swelled, any discharge, drainage. Then I'm going to get my stethoscope out and use the bell side. And his heart rate should be 110 to 160. Then I'm going to warm up the stethoscope. And I'm going to start with aortic, pulmonic, Erb's point, mitral, and apical for 1 full minute. Then I'm going to listen to his lung sounds for 1 full minute. They should be 30 to 60. And his lung sounds sound good. His respirations are even and symmetrical with his abdomen, which is normal. And I don't hear anything in his lungs. Then I'm going to assess his bowel sounds. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And no aortic brutes. Bowel sounds are active. His lung respiration rate is 25, and that is abnormal. So I would notify the provider. His pulse is 150, so that is normal. So then I'm going to assess his range of motion. Make sure his arms can go all the way around. There's no crepitus. Okay. And then make sure there's no clicking. So he has active, passive range of motion, bilateral upper extremities, bilateral lower extremities. Then I'm going to assess his pulses. So his radial pulse 2+, and DP and PT pulses are 2+ by lat. Then I'm going to make sure he has 5 fingers, so 10 fingers, and then 10 toes. And he does have 6 toes on this foot, so that's abnormal. I would definitely let the provider know that. Then I would do cap refill, make sure it's brisk, less than 3 seconds. Then I'm going to assess the palmar reflex. That's where you put your finger in his hand and he grabs it, so that's positive. And then do his plantar reflex, and that's where you put your finger at the bottom of his toes on the bottom and he grabs onto it, so that's positive. Then assess the Babinski sign, where you rub his foot and his feet flare out, so that is positive on both sides. And then I'm going to make sure that the umbilical is intact, there's no drainage, make sure the diaper is below. And so then I'll take off the diaper. I'm going to assess for any edema. Make sure both testes are there and they are both intact. Look at his anus, make sure there's no bleeding, swelling. And he has had his first meconium stool, so that's normal. And make sure there's no jaundice, and make sure his hip folds are symmetrical. Also going to make sure that his arms are the same length and his legs are the same length. Then I'm going to support his head and flip him over. Then I'm going to make sure that his spine is aligned up, and make sure he doesn't have dimples, which he does have dimples, so that is abnormal as well. So I need to let the provider know. And then I need to make sure that his gluteal folds are symmetrical, which they are. And he does have also a Mongolian spot, which is normal, a normal birthmark. So I'm flipping back over. Then I'm going to get his temperature. So I'm going to put it under his arm, make sure it's not all the way through. Should be 97.7 to 98.6. And his is 98. So then I'm going to swaddle him back up. Make sure he's nice and warm. Then I'm going to ask Mom if she needs anything, if I can get them anything, and make sure the bowl syringe is still in the bassinet.